Well, the Trump administration announced that the use of acetaminophen during pregnancy could be linked to the development of autism in children. Acetaminophen is the active ingredient in the painkiller Tylenol.
The Trump administration also promoted the use of leucovorin as a potential autism treatment. Joining us now is Dr. Mena Mirhom, assistant professor of psychiatry at Columbia University Medical Center. Doctor, welcome. We want to start with the science. Is there any credible evidence to support this claim about acetaminophen?
Good morning. There is. There are, of course, levels of evidence. The best evidence that we have says no. This is a large study out of Sweden of 2.5 million folks over 25 years. But there is a small study that was actually just published recently, and that's where these concerns are coming from, to say, could there be a link? Is there a relationship? And actually, the lead authors of that study said, we can't say that there is definitely a cause, but it did raise the question of perhaps there is a link. So even though the best evidence says no, there is some evidence that raised the concern, and that's why we're here.
Well, let me ask you this. The fact that there is evidence out there, like you just said, does it raise to the level of concern that we saw yesterday with a big press conference saying to the world, do not take Tylenol if you're pregnant, from the President of the United States?
Well, if we're going by the evidence itself, if the lead author is saying we are not saying this is a causation, we are not saying this is a definite direct cause, that's why the medical community is pushing back a bit on that level of concern. But the FDA commissioner or others are saying, you know, if you're looking at a low-grade fever or you're looking at mild pain, is there evidence or reason for judicious use? Perhaps. But we would say the reason that there is certainly not an established direct cause and link, that is the pushback in saying we can't say that there is this level of link between Tylenol and autism.
So let's say people out there right now, pregnant women, are saying, okay, I'm going to listen to the president. I'm not going to take Tylenol. If, let's say, a pregnant woman is suffering from a fever, the president said yesterday, his quote was, they just have to not take Tylenol and tough it out. Is that something doctors are going to be recommending, you feel, to patients, to just tough it out?
No, well, the reason that this is the thing is when you're a pregnant woman, there is no zero risk option, right? There's a matter of harm reduction. So if you're dealing with a fever, that has its own risk to the mother and the fetus. So we recommend for mothers to be able to say, well, you know that if you're dealing with a fever or a lot of pain, those carry their own risks. So the use of Tylenol is actually now one of the few things that we can use to mitigate that risk. So that's one of the things that we're saying we should still be using that. Definitely talk to your doctor, but there is still strong evidence to tell us that it's safe and effective. But perhaps if you're looking at low grade or mild pain, that's the place where we can be a little bit more careful.
All right, Doctor, the administration also pointing to leucovorin, which is often used with cancer treatment, as a potential autism therapy. So what do the studies actually show so far about that?
So we have very small but very promising studies, because we're in a place right now in autism where there is no FDA-approved treatment. So a medication like leucovorin, which essentially is folic acid, in some small studies of 48 children showed pretty good increased verbal communication in children with autism. So there will be a genetic test that could be used by a doctor first to see if this would be helpful. But even if not, if in a small subset of patients that are given leucovorin, and you can see basically folate is important to help in neural development in children. So when this can be used and can be showing some improvement with very little side effects, essentially a vitamin, that's why there's some promise around this medication, even though it's not certainly going to help everybody in every case, but it is something that is a good direction for us to look at.
Dr. Mena Mirhom, thank you so much. We appreciate you talking with us this morning.
Of course. Thank you for having me.
Good to see you.